and welcome to our weekly COVID-19 update. I'm joined today by Regional Councillor Rowena Santos, along with our Director of Bylaw Enforcement, Commissioner Paul Morrison, and our Medical Officer of Health, Dr. Lawrence Lowe. Before I start, I just want to say in Brampton, we were heartbroken and stand in solidarity with the Muslim community in our city after seeing the events in London, Ontario. It was beautiful to see people come together virtually last night to highlight then that when one group is attacked, we all feel that attack, and we stand proudly in support of the Muslim community against hate, against Islamophobia. The first thing that I wanted to speak about today in regards to our COVID update is the upcoming reopening. On Friday, June 11th at 12:01 a.m., things are changing. There's some gradual reopenings. Outdoor limits for social gatherings and organized public events will be expanded to 10 people, including with members of different households. Outdoor religious services, including wedding services and funeral services, capped at a number of people that can maintain physical distance of 2 meters. Indoor religious ceremonies or ceremonies including wedding services and funeral services permitted at up to 15% capacity of the particular room. Non-essential retail is permitted at 15% capacity with no restrictions on goods that can be sold. And outdoor fitness classes, outdoor groups and personal training, and outdoor individual team sport training is permitted with up to 10 people. And so I want to thank the province for this gradual reopening, and we are certainly ready for it in Brampton. With the beautiful weather in the forecast, we have done our best to make sure our recreational amenities are ready for these pending changes. As a reminder to everyone, splash pads are now open citywide. The wading pool at Shinkuzi Park is scheduled to reopen for public on Friday as well. Also available for residents this summer are in-person summer camps. With the go-ahead from the province, we have our summer camps ready to start. You can select a City of Brampton summer camp by going to our city website. Registration is now open, and summer camps start on July 5th. Residents can call 311 if they have any questions. I also invite you to enjoy new, free, open outdoor workouts returning 7 days a week in our parks this summer. Free outdoor fitness, a great way to stay active. The program has been expanded to offer residents more options to engage in safe, open-air fitness activities during the warmer months. Days, locations, and time slots have been expanded for increased capacity, so we're hoping there's a big uptake of our outdoor fitness in the park. And once again, residents can visit the city's website to confirm their spot. I also wanted to speak today about our ongoing concerns with the Delta variant. And I have to say, there is a lot of good news right now. Case counts are going down. The hospital capacity is getting better. The positivity rate is going down. The incidence rate is going down. But we do need to keep an eye on the Delta variant. As our medical officer of health has said, it could very quickly become the dominant form of transmission. And Brampton Council last week passed a motion calling for second dose prioritization for our vulnerable essential workers. I think right now Ontario is making great progress stamping out the spread of COVID-19, but this is an area that could cause some ongoing pain if we don't take it seriously. The lessons from the first 3 waves is we know where the spread starts. It starts in our busy factories, and we have tons of them in Peel region. Crowded, busy factories that are critical to Canada's supply chain. And I would implore the provincial government to make sure we have second doses for those essential workers. 1 dose doesn't provide significant protection against the Delta variant. 2 doses does of the vaccine. The average age of an essential worker in Brampton is 36. And right now, only those over the age of 70 are eligible for a second dose. So I am concerned if we don't get those essential workers the protection as quickly as possible, that we could see spread continue and last longer than it needs to and slow down our ability to really get back to normal. But I think that message is being heard loud and clear, and I'm grateful that the Ontario Science Table and Dr. Peter Juni has echoed the calls that we've heard from Toronto, Brampton, and Mississauga to prioritize our essential workers. In terms of a bylaw update, I want to thank the residents of Brampton. This is the best week we've had during COVID in terms of the least number of infractions, only 4 charges under the Reopening of Ontario Act, which means a high level of compliance. Everyone understands the rules, and I'm encouraged by this level of compliance. In terms of the William Osler Health System, there are currently 23 COVID patients at Brampton Civic Hospital, including 8 at ICU. That is also down dramatically, and so it's very encouraging to see our hospital picture get significantly better. There are a further 15 COVID suspect patients, once again a smaller number than we're used to reporting. So on that note, that covers my update. I'm going to invite up Regional Councillor Santos to share a message from our City Council, and then we'll hear from Dr. Lawrence Lowe.
Thank you very much, Mayor Brown, and good morning, everyone. I'm Councillor Rowena Santos, and I'm very pleased to join you here at our COVID update and also share with you what the city is doing to celebrate the many diverse cultural events that are happening in this month of June, and my goodness, there are a lot of them. The City of Brampton will pay tribute to its multicultural mosaic virtually by recognizing its Italian, Portuguese, and Filipino communities, in addition to observing National Indigenous Peoples Month. Italian Heritage Month began Wednesday, June the 2nd, Italian National Day, with a flag-raising ceremony and a virtual set of activities throughout the entire month. Portuguese Heritage Month begins tomorrow, Thursday, June the 10th, the Day of Portugal, with a virtual flag-raising ceremony, an introduction to history and a celebration, as well as traditional recipes and photos celebrating past events. Near and dear to my heart is Philippine Heritage Month. As the first Filipino elected in Brampton, I am so proud of what we are doing this month virtually in June. Mabuhay! There are virtual flag raisings as well as a pre-recorded performance of the national anthem of the Philippines. We will also have a video of the renaming of a park in Northeast Brampton dedicated to Dr. Jose Rizal, one of the greatest heroes of the Philippines. We will share some history, celebrate, and also provide 2 traditional recipes in the Filipino community and a photo gallery of pictures from past events like the Mayor's Halo Halo Party in 2019. In June, we recognize National Indigenous Peoples Month to honor the history, diversity, and distinct contributions of the First Nations, Inuit, and Métis peoples in Canada. The City of Brampton recognizes and acknowledges that our work takes place on the treaty territory of the Mississaugas of the Credit First Nation, and before them the traditional territory of the Haudenosaunee, Huron, and Wendat. We also acknowledge the many First Nations, Métis, Inuit, and other global Indigenous people that now call Brampton home. We are honored to live, work on, and enjoy this land. We commemorate those who have tragically been impacted and lost their lives through systemic injustices and mourn the loss of the 215 children whose remains were discovered at the site of the residential school in Kamloops. We stand in solidarity with Indigenous peoples and reinforce our commitment to reconciliation. National Indigenous Peoples Day begins with a virtual flag-raising ceremony, followed by an online performance by Crown Lands. There will be a land acknowledgement from Chief R. Stacy Laforme from the Mississaugas of the New Credit, a feast plate, a virtual strawberry moon teaching with Tracy White-Eye, and a traditional corn soup teaching with elders Jaabakwe and Joyce Tababondog. For more information, visit brampton.ca NIPD. Finally, on behalf of the Mayor and members of Brampton City Council, Happy Pride Month. Love is love is love. We will be celebrating our LGBTQ at 2SQ community online through art, performance, education, and programming for all ages. Go to brampton.ca/pride for a full list of virtual events. New this year, we recognize Peel Pride and their generous donation of 2 Pride benches to the city's Garden Square downtown. In partnership with the City of Brampton, Peel Pride helped turn Garden Square's Pride in the Square event, now in its 4th year, into a major annual event and a signature summer celebration. If you are downtown, we invite all of you to snap a photo with the new benches and post them to social media with the hashtag Brampton Pride. Thank you to all of the many community organizations who come together to make events like these happen. We take pride in Brampton as a mosaic. Grazie, obrigado, salamat, miigwech. Thank you. Back to you, Mr. Mayor.
On that note, it's my pleasure to introduce Dr. Lawrence Lowe, our Medical Officer Health, for his weekly update.
Good morning, Mayor Brown, Councillor Santos, Brampton and Peel residents, and thank you very much. This week, Brampton's test positivity is at 7%, with a weekly incidence rate of 73 per 100,000. These are the lowest numbers that we have seen in our community since the fall of 2020. At our hospitals, patients are recovering and being discharged, and surgeries are looked to be starting up soon. And our vaccine coverage rates are increasingly impressive. The numbers speak for themselves. 1.2 million doses delivered, 74% first dose coverage of 18 plus in our community, 75% first dose coverage of 18 plus in our high priority hotspots as designated by the province, 81% first dose coverage in our 18 to 24-year-olds, 78% first dose coverage of our 60 plus, including 44% second dose coverage, i.e. complete immunizations, of our 80 and up population. These numbers mean that we are starting to see differences in our transmission patterns, and I want to thank Peel residents and businesses, first, for your sacrifices that have got us out of this third wave and made a difference, and secondly, for your willingness to get vaccinated. That said, while these numbers give us all a cautious optimism, it's not time to fully start to celebrate. With step one reopening starting on Friday, we must remember that the science table has advised that the Delta variant is growing in Peel ahead of the rest of the province and will become the dominant strain in just a few weeks. And so today I want to talk a bit about patience. Like many of you, I love summer. Canadians wait all year for the magic of these long days and warm nights. And so I know that our residents have what it takes to be patient, to be able to hold on a little bit longer and put this firmly behind us. On Friday, I want to remind our residents that these are not the first step, these first steps to reopening are not a full return to normal. We do have high first dose coverage, but we have low second dose coverage, and the science shows that only 33 to 50% protection is afforded against the Delta variant with one dose. That protection may not be enough to forestall a resurgence if we reopen and re-engage too quickly. So we must continue to emerge gradually in our lives and our reopenings. You can start to meet with people outside your home, but continue to limit your contact and ensure that you're following precautions. Do not hold any large gatherings, and ensure that you're always masking, distancing, and favoring the outdoors. And while we're talking about patience, one thing I encourage you to not be patient about is your vaccine. Please, do not wait to get vaccinated. Get your first dose if you haven't already. I've heard that some people might be anxious about getting a needle, particularly those aged 30 to 39 who are our lowest covered age group at 60% first dose coverage. I encourage you, if you have been vaccinated and you know someone who may be anxious about the needles, please share your own story to reassure them and tell them that our providers are able to immunize them in private and provide support at all of our clinic sites. And for those of you who have already gotten your first dose, get your second dose as soon as you're eligible. Visit peelregion.ca/COVID-19 vaccine for information and to book online. On that, Peel Region and our hospital partners are following the science table's advice. We are increasing capacity through this week after having reduced capacity in the past 2 weeks following the end of the province's first dose hotspot strategy. In fact, this Saturday we are trying to break a Peel record at the CAA Centre, delivering 6,500 doses in an 8-hour clinic. So I encourage you all to book your appointment today and possibly at the CAA Centre for Saturday to get in on what will be a fun clinic with plenty of action. We aren't waiting to give out shots, and you shouldn't wait to get one either. Finishing first doses and then starting to get to widespread second dose coverage is needed to stay ahead of the Delta variant and to keep not only Peel, but all of Ontario on track to reopen. So please bring your patience to bear in the right manner. Continue to keep your contacts low and hold off on the large gatherings for a little while longer, and don't wait for your shots. Get both doses without delay. Thank you, and I'll pass it back to Mayor Brown.
So on that note, we're happy to take any questions. Our first question is from Courtney Hales from CP24.
Good morning. My question is for Dr. Lowe. When you're talking about the spread of the Delta variant in Peel region, are you able to share where you are seeing cases of this variant? For example, are you seeing it in warehouse settings right now? And are you also seeing people who have been vaccinated with their first shot becoming infected?
Thanks so much, Courtney. I can confirm that there's just under 10% of the Delta variant cases that we have identified were partially vaccinated. We do need to actually look at further information to identify whether they acquired the infection during the initial period after their vaccination, where they may not have been fully protected. And then in terms of where we're seeing it, it is accounting for approximately 30 to 35% of the positive samples that are coming back in the region of Peel right now, and that can be linked to all sorts of exposures. Certainly we've seen it in workplace outbreaks and household transmission, et cetera. So it is reasonable to assume that it is an increasing proportion of our overall community transmission and will continue to grow per the science tables modeling. Thanks for the question.
Thank you. And my next question, I'm hoping Dr. Lowe and Mayor Brown, you can comment on this as well. It's some breaking news we're following now this morning over sources confirming that the federal government is going to announce the mandatory hotel quarantines for fully vaccinated travelers. So those who have both shots, they won't have to quarantine in hotels any longer. So I know this is breaking, so you're probably just hearing of this now. Do you have reaction to this announcement we're expecting to come today from the Fed?
Well, this is the first time I've heard of that. I would say I think the science is clear with fully vaccinated individuals that you can lift restrictions. For those that aren't vaccinated, I wouldn't support lifting any restrictions. And I continue to be concerned that there is a high volume of flights coming into Canada from hotspot countries like India and Pakistan, and they're simply being rebooked through other countries. We get feedback on that on a daily basis from different community groups who are noticing it. But if it's an amendment restricted only to fully vaccinated individuals, I wouldn't have any opposition to that.
Yes, thanks, Courtney. And I'll just echo Mayor Brown's comments. This really, if anything, speaks to the need to push to high levels of two-dose vaccination in our community and throughout. We know that even with 2 doses, there is still the possibility, 9–10% that you may be able to acquire the infection and possibly pass it on to someone. And so people who remain in the community who are unvaccinated, they may be at risk. So it really is that encouragement, first of all, for people who wish to travel to start to get their, to ensure they get their 2 doses without delay. And there will also be other changes, I imagine, to precautions, though it is still at this point in time, we're treating 2-dose vaccination. You still need to limit your contacts. You still need to mask and distance as much as possible while our community transmission is resolving. But I hope that this is impetus for people to get their 2 doses of vaccine, and for both to ensure that they are protected should some people come back and maybe are harboring a mild vaccination, and also for the potential ability to travel in the future. Thanks for the question.
Our next question is Irene from 680 News.
Good morning. My question is for Dr. Lowe. You mentioned an increase in capacity in giving the vaccinations, but of course capacity can only be increased with supply. Is Peel Region going to be getting a greater share of vaccines because of the concern of the Delta variant?
Thanks so much for the question, Irene. Certainly at the end of May, at the end of the hotspot strategy for first doses, we reduced our capacity and also started to ensure that there was sufficient inventory to cover commitments. We have now I have now directed to our team at Peel Public Health that our focus is to basically burn through that inventory as much as possible. Of course, we will do so in a manner that gets us down to some sort of limited buffer, but really we are following following the science table's advice here. We want to get doses, second doses out to our community as quickly as possible, and any assistance that we get from the ministry, both in respect of expanded eligibility as well as additional supply, will be absolutely vital to meeting that. Thank you very much for the question.
My follow-up is also for Dr. Lowe. As people book their second dose, we know that you can mix the doses, but it's preferred to have the same. When people are going online and booking their second shot, how do they know if the clinic is offering, if it's a mass vaccination clinic, Pfizer or Moderna? With the pharmacies, we know ahead of time. How do we know with the mass vaccination clinics?
Thanks, Irene, for the question. I think the provincial booking system requires you to actually select what your first dose was, and so that's how various clinic options will subsequently be given to you as you go through the booking process. In respect of our hospital partners, they have also been using their own booking systems and have been guaranteeing pieces, and they've only been using one product in general anyway, so they won't have an issue. But for our clinics on the provincial system, you are required to put in what you got as your first dose to assist with the overall booking process for your second dose. Thanks for the question.
Our next question is Sabrina from the Mississauga News.
Hi there. So my first question is for Mayor Brown. So I just wanted to talk about your calls for the additional allotment for second doses for essential workers in Peel. Have you talked to the province about this? Are they aware of your concerns? Is there anything that you can share moving forward?
Well, there's ongoing conversations with the province. They're certainly aware of our sentiments in Peel. We haven't had a response yet that we like, but we're going to keep on pushing. It took a while previously, during the previous wave, to get Peel designated as a hotspot with additional vaccine allotment. But when that happened in early May and we had that 2 or 3 weeks with additional vaccines, if you look what happened after, the numbers went dramatically down. Vaccines paved the way to get back to normal. Vaccines allow us to get our crowded factories under control. That's where the spread started, and it went from the crowded factories in the GTA and spread out around the province. And so my hope is that as long as we can contain this Delta variant, we're not going to worry about a spread beyond the GTA. By protecting the hotspots, you protect the rest of Ontario. And, I know we've heard that argument again and again and again, and the Ontario Science Table and the top infectious disease doctors in the province have reiterated that, but we haven't got a commitment for additional second doses as of yet. They continue to distribute them on a per capita basis, and I would say, and I'd underline, if you look at the positivity rate in a place like Kingston and compare it to Brampton, it's a night and day different picture. It continues to be. And so I really think you need to focus on where the fire is, where the spread's happening, where it needs to be contained, and that continues to be in places like Brampton, Malton, North Etobicoke, Scarborough. I think we need to be more strategic because this virus isn't equal. It treats a rural setting differently than it does a densely urban populated area. It treats a crowded factory different than someone who's working from the comfort of their home. And I would have assumed we would have learned these lessons in the last wave, but we're having this discussion again, unfortunately. Sabrina, is there a follow-up question?
Yes, so my follow-up question, thank you so much, Mayor Brown. My follow-up question is for Dr. Lowe. So now that we are moving into our second dose vaccine strategy, I know in the U.S. there was some hesitancy for some to receive a second dose. Personally, I've heard some concerns from people in the community that there are more severe side effects when someone does receive a second dose. Do you have any words on that for hesitancy to receive the second dose?
Yeah, thanks for the question, Sabrina. Upon the opening of the booking system to 70+ and the first tranche of people who received their first doses before April 18th, the provincial booking site crashed. We are now booked out through till the middle of next week across all of our clinics. So while I do recognize that there may be hesitancy out there, there is also clearly a demand. And as I mentioned in my remarks, I'm so grateful that those, our residents here in the region of Peel, I think they understand that the vaccine is safe. safe, that's effective, that it is our way to really put all of this behind us. So I think my message would be, for those of you who've done your part, who've booked your appointments, for your second doses, thank you. Remember as well that we have, we're trying to break a record, 6,300 doses at the CAA Center on Saturday, 6,300 within an 8-hour period. That would probably be a record not only for Peel, but possibly across the country. So we're trying to get that record in there in terms of fastest vaccinating. I encourage you to book your second doses without delay if you're eligible, peelregion.ca/COVID-19 vaccine. Help us get ahead of the Delta variant. And for those of you who maybe are concerned about side effects, all those who may have had challenges with the first doses, I know people who had lots of side effects with the first dose, nothing with the second dose. I've had people who had it the other way around. I had people who had nothing with both doses. The reality, though, is that most of the side effects you might have, they're going to be mild. I certainly, after getting both doses of my own, I basically just had a really sore arm. And so I think it is, or actually I should say I still have a sore arm because I just got my second dose. But I really want to highlight to everybody, the side effects are mild. The side effects are, much less compared to COVID. And they are a small price to pay to make sure that we have certainty that when we reopen, we are going to stay open. Thanks so much for the question.
Our next question is Jeffrey from insaga.com.
Question for Dr. Lowe. As we continue, the AstraZeneca second dose, as we continue to ramp up the second dose issue, a lot of uncertainty still regarding the AstraZeneca. Do we have supply to give everyone who got the first the second? And there is some new studies out there that is saying that if you got the AZ first, perhaps getting the Pfizer or Moderna second actually gives you more resistance.
Absolutely, yeah. So there's a couple things here. Yes, there is supply. The supply of AstraZeneca has been extended until the 1st of July to facilitate the delivery and offering of second doses to individuals who got AstraZeneca in the first instance. However, the National Advisory Committee of Immunization is very clear that you can also substitute a second dose of an mRNA vaccine, whether it's Moderna or Pfizer, with the AstraZeneca if you got it as your first dose as well, provided the interval has been met. There is some question around, and there is, so let's put it this way, completing 2 doses either with 2 AstraZenecas or with 1 and 1 of AstraZeneca and mRNA, they're both effective. There's some questions of maybe slightly more effectiveness with a second mRNA, but also slightly more side effects. And the reality is that either way, whatever comes available to you, it is the surest way to ensure that you are protected against COVID-19 and certainly the variants that are cropping up in our community. Thanks for the question.
Is there a follow-up, Jeffrey?
No, thank you.
Thank you. Our next question is Nitin Chopra from Prime Asia TV. Nitin, can you hear us?
Hello?
Yes, Nitin.
Yeah. Yes, my first question is to Dr. Lowe. Dr. Lowe, do you know, this Delta variant, as you said, it will be the dominant variant in coming weeks. So is it still coming through flights or airport or mutating locally?
We have community spread of the Delta variant at this point in time, Nitin. There are certainly Delta variant cases that are associated with travel, but as I mentioned in one of my previous answers, we're seeing the Delta variant associated with outbreaks and exposures within our community as well. Thanks for the question.
Follow-up for Mayor Brown. Yes. Mayor Brown, cannabis stores, 40 stores in Brampton, 0 in Mississauga. Brampton residents want to know, those who are opposing that Brampton might be a hub for cannabis. What do you have to say to them? Thank you.
Well, as you know, cannabis was legalized across Canada when Prime Minister Trudeau was elected. It was part of his election mandate, and Ontario has had a rollout that provided funding for police and bylaw for municipalities that opted in. And so Brampton, like many communities, opted in. We have tried. There was a motion that Councillor Singh put forward to cap the number at 5. That motion failed on a 5-6 vote. So we're continually looking at ways to find a balance that works for the community. But any suggestion that it's not going to be a legal product or not going to be available It is. Let's not be naive about that. No one is suggesting to make it illegal again. And so we're just trying to find a way, now that that debate is complete, that we can make sure that it's governed in a safe manner, where bylaw shuts down illegal dispensaries that are in the black market, that drug-impaired driving is stamped out, and so we're more concerned about the safety of our residents, given the fact that municipalities do not choose whether this product is legalized. And we're working with Appeal Police and bylaw to make sure that we can provide as much safety to our residents as possible. Our last question is for Nikki Cedrone at the Bramptonist.
Hi, good morning. My question is for Dr. Lowe. Are we going to do anything differently to prepare for the fall for a potential fourth wave of the variant?
Thanks, Nikki. In fact, the potential fourth wave of the variant is brewing right now, and that's why I think you've heard myself and Mayor Brown really pointing to the advice that we've received from the science table to accelerate second doses in communities that are seeing Delta variant activity, such as ours. So, I think the things we're doing differently are about right now, and that's why we are ramping up our capacity again after having been directed by the ministry to ramp down in the back half of May. We are now ramping up. We're going to basically burn through whatever buffer we had built up in anticipation of the reduced allocations, and we're going to just try to get second doses out there as quickly as possible. Thanks for the question.
Thank you. That's all I have.
Okay, well, that completes our weekly COVID-19 update. Thank you for tuning in, and stay safe until our next update.